We know people are sick of the mask, we get it. And their mask mandates are virtually over, which, okay, get it. But still, make sure that you do what you can in terms of boosting and all those other things and staying 6 feet apart and all of that kind of stuff that you need to do. Keep yourselves safe and the people who you love. COVID is still right here, no matter what we think. Watch this.
Thanksgiving travel hit close to pre-pandemic levels in the U.S. last month, but millions of Americans are now paying for all the close contact that came with those holiday gatherings. Health centers here are also overwhelmed with the flu, COVID-19, and RSV cases. After U.S. Thanksgiving, COVID hospitalizations reached their highest level in 3 months, with more than 35,000 patients treated. And Christmas, Hanukkah, and New Year's celebrations are just around the corner.
And so it's just a reminder that the more people who are hospitalized for COVID, that puts a strain on the system. So people who need other services. So again, we definitely are all in this together. Get it, the mask thing, we got it. You needed a little relief, but we still should practice, we should still conduct ourselves in a way that says we understand that we might be done with COVID, be over it. COVID is not over us. But we also want to take a look at this chart that shows the rise in cases. There it is, up, 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 up and away. As you can see, there is a tremendous spike in cases over the past 2 months. The current 7-day average of new COVID deaths is currently 386, according to the CDC. And let us not forget that over 1 million people in this country have died from COVID or COVID-related illnesses, and we didn't blink. Adrienne, I remember there was a pastor that was giving a sermon, and I thought it was very apropos what he said when he said, over 1 million people died in this country from COVID, and we did not pause for a national mourning.
Yeah, and honestly, it seems very much on par with almost how we've been conditioned by virtue of the fact that we have a federal government that spends a bunch of money on war, and we have a federal government and a Congress and leaders who allow for children to be murdered in their schools. We don't value humanity. We talk a good game about it, and we love to say uplifting in God we trust and push this Christian agenda and whatnot. But the reality is, oh no, we value them coins and maintaining systems of oppression, but we don't value individual lives. And so it seems right on par for people to kind of just keep it moving when 1 million people are lost. And the fact is, it didn't have to be that way. Had we had the measures in place, had we enforced them steadily and readily, we would not have lost so many lives. But unfortunately, as a result of our leadership and unfortunately as well as our conditioning, I'm not shocked.
Oh, you're right, Adrienne. Those two things go together, our conditioning, and we don't talk about that enough. We talk about the leaders, but we don't talk about our culpability in this as individuals. And you're right, it is our conditioning. And that pastor was Bishop Jamal Bryant, but it just hit me when he said that. It made so much sense that we did not pause for a national mourning. Now, doctors are now up against it once again. Our essential workers, our doctors, our nurses, everybody in the hospital ecosystem are essential, no matter what they do, whether they're the ones that are bringing the food or the ones that are cleaning up the hospitals, keeping the hospitals sanitary. Everybody is important. The American College of Emergency Physicians has asked Americans to take precautions to limit the triple threat of respiratory illnesses, particularly on the cusp of the holiday season, as Americans will be traveling and gathering with loved ones. Christopher S. King, president of the American College of Emergency Physicians, said emergency departments are struggling to handle the high number of patients. So let's do what we can. Again, if the hospital system is overwhelmed with COVID-related things, then somebody had a heart attack, unfortunately had a stroke, violent, any other type of violence that may be inflicted on someone, that system will have a hard time dealing with those other cases because of COVID. So it's not just about COVID, it is about every other thing that animates our lives on a regular basis. So all of us must do what we can. And just because we collectively feel that we've done enough, we have not. There's always more that we can do. Looking at you, President Biden, had this to say in September.
Mr. President, first Detroit Auto Show in 3 years.
Yeah.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
The pandemic is over, but we still have a problem with COVID. That doesn't make sense to me. I'm gonna quote Councilwoman Fannie M. Lewis like I did yesterday. That's clear as mud, Mr. President. Just does not make a whole lot of sense. Listen, people, don't listen to him on this. The pandemic is not over. COVID is absolutely still a problem, and every other thing that was a reality for the most downtrodden in this country, COVID just made it worse. So it's not ever going to be over in that we can flip a switch. That's the thing that's really getting to me. They acting like we can flip a switch and COVID is gone and all the suffering that has been compounded by COVID. No, it is not over. Don't listen to him. Listen to what the doctors are saying.